So today we're going to talk about when you diagnose a patient with subarachnoid hemorrhage on CT brain. If you see this CT brain, we do having these are the hyperdense or bleed in the subarachnoid space, basal cisterna, interhemispheric. All these white hyperdense areas are bleed, and that is in the subarachnoid space. So we diagnose this patient with subarachnoid hemorrhage. When you diagnose patient with subarachnoid hemorrhage, the next step you should do CT angiogram of head. Simply we say CTA head because 90% the causes of subarachnoid hemorrhage or aneurysm rupture. So we have to rule out the aneurysm. Is the cause is aneurysm or not? So we did the CT angiogram of this patient, and we got here this one small aneurysm, this outpouching. This is the anterior cerebral artery, right and left anterior cerebral artery, and this is the anterior communicating artery. And so here you see this outpouching is called a ACOM aneurysm, anterior communicating artery aneurysm. Okay, like you guys can see here, this outpouching, this small outpouching, this one is ACOM aneurysm. Now this aneurysm should be coiled so that we can protect the patient from rebleed. If we didn't coil this, the chances of rebleed is also very high, and if it's rebleed, the patient could be die. The mortality rate is 100%. So when you diagnose subarachnoid hemorrhage on CT brain, next step you do CT angiogram of head, in which you will detect the aneurysm, and then do coiling for aneurysm. Unfortunately, this patient we got very late the patient, and we were preparing the patient for coiling, but before the coiling the patient lead to rebleed, and the rebleed because of the re-rupture of the aneurysm. And now you see that this CT brain is now inside. You see the brain, everything you see white, hyperdense, all these are the bleed, and this bleed is now developing the pressure in the brain and also hydrocephalus, and mortality of this patient is 100%. So always it is very important when you diagnose subarachnoid hemorrhage and CT brain, do CT angiogram of head and rule out any aneurysm. If there is an aneurysm, then do the coiling. If you didn't do the coiling, then if it rebleed, the 100% mortality is 100%. Now you just compare how bad looking is this CT brain, and when you see this CT brain, the bleed is very less, and the patient GCS was 15/15. But after rebleed, re-rupture of the aneurysm, now you see the brain is, even the ventricle, this is the lateral ventricle, which you see CSF is black, but now this lateral ventricle is even full with bleed, with hemorrhage. You see this is hemorrhage, this bleed, all these are white hyperdense area bleed, and now the brain is full with bleed, and the mortality is 100%. Thank you.